previous videos, we looked at mobilization of the sacrum. So the sacrum is a piece of bone that's between the two outer pelvic bones, and you're connected in there by sacroiliac joints. Your spine sits on top of that. Your sacrum needs to have the ability to tip forward a little bit, just like this one is. That allows your body to get a nice lordosis and gets the back muscles relaxed. Very often, what we see is the sacrum is tipped back a little bit. So we have this Doorframe backward bend exercise we're going to do. So I'm going to have Will identify the two pieces of the outer pelvic bone, and he's going to rest his fingertips just inside of those on either side. So that area is called the sacral sulcus. Once he has his fingertips placed in there, he's going to put his back against the Doorframe here. So his feet will be all the way back. His upper back's back against it. So he has his fingers resting in the sacral sulci. Now from here, he's just going to gently let his pelvis drift forward. And he's doing this kind of in a bowing fashion. So it's not just tucking, it's just a gentle bow. As he does that, he feels that area back there soften up just a little bit. Now very often, this is difficult to feel because the muscles will tense up. So if your muscles tense up, come back a little bit, start all over again, and softly let things come forward so you feel everything soften. So you should feel that little depression get a little deeper as the muscles relax and that sacrum tips a little bit. Now from here, he's going to let his pelvis just drift a little bit to his right, and you're going to feel the left sulcus soften up a little more. If that's successful, then you're going to turn, just gently let your pelvis rotate a little bit, like these headlights are going to turn a little bit in the right direction. You should again feel that left sulcus get a little deeper. Now he can just hang out there, or he can kind of wiggle and find whatever he can do to trick his body into making that relax a little bit more on the left side. Now once he works on that side, he relaxes out of that and let the pelvis come back. Compare that with the right side. So his pelvis comes forward just a little bit. He drifts into his, just drifts softly and add a little rotation. Try to avoid letting the shoulders rotate. So it's just the pelvis coming forward, drifting in a little bit. So we find it's good to do in a Doorframe to learn how to do it, because then you won't get all kinds of extraneous motions with the upper body. But right now you should feel that right sacral sulcus just getting a little deeper. This can be a frustrating exercise because you're trying to feel a little bit of movement, but you're feeling it through a good inch and a half of tissue. I have some patients that are very good at this. It gives them a lot of relief during the day because they can do it anytime during the day. I get other patients that practice it and they just don't have the sense of how things are moving, or they're just too tight and they don't move. So you can do the towel mobilization or tennis ball mobilization before you stand up and do this. But it can be a very nice technique to do during the day. It helps also get a little bit more back extension, kind of takes you out of the flex position. Again, it can be a nice thing to do during the day to kind of just get the back muscles to relax.